Thank you, LaRue. Good morning, everyone, and welcome to our information gathering session. It's really great to have you here. The title of this panel, our first panel this morning, is Perspectives from Example Initiatives on Opportunities and Challenges for a Birth through 8 Continuum. And our basic objectives here for this panel are to inform the committee about programs or policy elements across the birth through 8 continuum that are currently being employed by these three representative initiatives, and to identify steps that have been successful and, of course, the challenges that have been encountered. And I just want to emphasize the key considerations here are really that 0 to 8 continuum and the collaboration that occurs to make those things happen. We will be having in the panel here an opportunity to respond to questions. And this session, this first part of the session is 60 minutes long. And then after that, there will be an opportunity for the committee to ask questions, about a 15-minute time, and then for the public as a whole, for the group as a whole, to ask questions for 15 minutes of the panel toward the end. So at this time, I'd like to introduce our panel members. And first of all, we have Harriet Dichter. Harriet is the Executive Director of the Delaware Office of Early Learning. We have Daphne Evans. Daphne is the lead facilitator for the Delaware Readiness Teams and the Delaware Early Childhood Center. And then we have Amy Galatz. Amy is the principal at King Elementary School in Deer River, Minnesota. And in full disclosure, I have to tell you that Amy was one of my board of director members at the Minnesota Elementary School Principals Association. And she's made a really big commitment to be here today because her son is in the hockey tournament back in Minnesota. Hockey is big in Minnesota. So thank you, Amy, for being here. And we have Mary Kozak. Mary is the program officer for the Blandin Foundation in Grand Rapids, Minnesota. And Kelly Chandler. Kelly is the Itasca County Public Health Division Manager in Grand Rapids, Minnesota. And I can tell you that the Minnesota contingent, including myself, is so glad to escape the polar vortex. All right, and last we have Jane Crowell. Jane is the Assistant Director from the Hartford Department of Families, Children, Youth, and Recreation, again in Hartford, Connecticut. And so I think we're really blessed to have a very diverse group of a statewide initiative, a rural initiative, and a citywide initiative. So without further ado, we're going to jump right into our questions. And our first question is, how have you handled alignment among existing institutions and organizations that serve children and families? So that alignment piece. Jane, would you start out, please?
Sure, I'd be happy to. We've handled alignment in many different areas in the city, starting with our constellation of leaders. We're fortunate to have leaders in Hartford that are very, very dedicated and committed to early childhood and recognize the importance of early childhood related to readiness gaps. Our mayor, beginning with that, established a cabinet for Mayor's Cabinet for Young Children, as well as an Office for Young Children in 2005. And later, the subsequent mayor has aligned and broadened that perspective to include and create a Department of Families, Children, Youth, and Recreation. And it's the only municipality in the Northeast that has a department exclusively dedicated to that initiative. So we're fortunate to have that leadership. We also include statewide partners. Our State Department of Education and now newly instituted Office of Early Childhood has been a key partner in that. Philanthropic agencies, regional agencies, we work very closely with our Regional Education Service Center. So the leaders in our municipality have been instrumental in helping us move this forward and in lining all of our initiatives. In 2005, when we created and launched the Mayor's Blueprint in Early Childhood, we had a fragmented patchwork of preschool programs and infant toddler programs. And it was that point in time that we realized that we really wanted to pull together to create a comprehensive system. And so with that, we formulated a shared vision and also took it upon ourselves to review current early brain development research, because so many of us did not have a shared understanding of what that meant, particularly for children who live in poverty, and you have to look and consider executive functioning and also toxic stresses. So in addition to that, we created supports for all of our programs by launching a citywide professional development initiative. And we created Instructional Leaders Group. It's really an institute of curriculum specialists that represent all of our city's programs, so all of our Head Start programs, all of our school readiness programs, all of our programs that are funded from a myriad of different funding sources coming together and having that shared vision, and also working towards standard-driven, data-driven instructional practices. We formed an administrators forum that meets monthly throughout the years to make sure that administrators in programs have the same understanding that the instructional leaders do. And then we have on-site coaching and monitoring. The coaching is provided to the instructional leaders in those programs, who in turn turnkey the information to their classroom instructional staff. So we have our coaches who go out and coach the instructional leaders, who then coach the classroom teaching staff. We also have monitors. These are separate people who go in and monitor the quality of the instructional practices in the classrooms, again, regardless of funding streams and regardless of different requirements. We're all looking at it through the same lens. They use a rubric that we've developed. We started with the state's rubric and have expanded beyond that, so that we're actually looking at teaching practices in classrooms, not just planning lesson plans. And we have a rubric, again, to measure that. Our leadership team is comprised of myself, the monitors, the on-site coaches, and we meet periodically throughout the year to make sure we're keeping in sync with what the needs and priorities of our professionals are. We created a citywide data system with our city's Department of Information Services, and our first priority in that data system was for it to be a tool for the instructional classroom staff so that they can improve their instructional practices. Our second priority was that it would provide information to administrators to improve the quality of our programs, and the last priority was to provide a citywide snapshot or data collection system so that we could review where children are and where our programs are in the city of Hartford. We also have a dedicated wiki space to ensure that everybody's corresponding and are on the same page. But one of the things I wanted to highlight around this whole alignment initiative is that it's not something that you can just decide in 1 year we're going to do massive professional development and we'll take care of it and everybody will be on the same page. We are now in our 5th year of implementation, and we probably will be in 5 more years. And so in the very beginning, we started with the workshops thinking that will take care of it. That did not. We had to add on-site coaching because people, when they hit road bumps, didn't have supports in place to move it forward. And so we did that, and then they became so dependent on those outside consultants, those coaches, that they didn't know how to find their way through issues when they came upon them. So we decided that we were going to require internal instructional leaders in each program, and that we would blast those individuals with professional development and on-site coaching so they could really improve their coaching skills. And that has made all the difference in the world, except when we started to go out there and look at the data. In many situations, when we're looking at child progress information, we did not have accurate observational formative data. And so we added monitors to go in, and we have 2 monitors now that go citywide every single day, unannounced and monitor the validity of the data that is being collected. So it takes time. It's not something that's going to happen overnight. We've also developed products around that. We have a product called Connecting the Dots. We had so many different published curriculum that were being used in the city that we had apples to oranges in many situations. And so we moved with the support from our state around standard-driven instruction. We use the early learning and development standards, and we have a preschool assessment framework developed by the state. All of our programs decided that they were going to go teach to that assessment instrument and those curriculum frameworks. And so now we're all on the same page. All of that information gets added into the data system, and we've also created walkthrough documents for them to use to walk through their programs. So I would say that leadership, common understanding of current brain development research, and a shared vision as well as the supports around it.
Thank you, Jean. And now let's transition from the urban program to our rural Minnesota program. And Amy, would you start out a little bit and talk about alignment, or whomever? Okay.
Okay. I represent the foundation, and it's in Grand Rapids, Minnesota, and we only support rural, and it can only be in Minnesota. So anyway, back in the 90s, when we started to do intensive research on early childhood education, we realized that the state really didn't support early ed in the way that it should. And we thought, well, maybe we could use some philanthropic dollars to jumpstart early childhood education. So in 1998, we called together a convening of our entire county, perspectives from every imaginable area that you could think of. About 240 people came. We developed the vision and mission for early childhood ed in Itasca County. And then we had some action teams that were working on the miscellaneous issues. And about 2002, we realized, we're doing a lot of great things, but we're really not tackling the big issue, and that is providing all-day, everyday care, year-round, to the kids that really need it. We did a big study. We had a matrix that we filled out of all of the agencies and organizations that were involved, all the programming that was being done, and we looked at what the gaps were. The two gaps were infants and toddlers. Very little to nothing existed for them. And the second one was the working poor, because there were dollars, obviously, for Head Start, for those in poverty, but those that were just right above that line, there was really nothing, because they couldn't afford any kind of quality care, and yet they didn't qualify for anything, any type of state or federal funds. So we thought that's where we need to put our dollars. And we issued a white paper and brought it to the board of trustees at the foundation and said, you know what, we need from you the green light to go ahead with putting out an RFP to tackle all of these issues, but what we need from you is a 10-year commitment, a minimum of 10 years. And then the other thing we talked about was a dollar amount. We told them it's probably going to be around $1 million a year, because you're talking about an average of $10,000 per child. Well, the board went with it, gave the green light. The proposal or the RFP went out, and what the RFP encouraged was quality, intensity, accountability, and systems change. Now, that systems change was a huge piece, and it's what addresses the question on alignment, because we were telling them, okay, we know we have all these great things in place like Head Start and early childhood family ed and school readiness and public health, et cetera, but why don't you guys work together? Don't you think you could be much more efficient and effective with all of the resources that are out there? So that's what our extra dollars encouraged, was all of these agencies to work together. And so now that has been what's come to be known as the Invest Early model. And we have what's called an Invest Early leadership team. They come together religiously once a month for an entire morning. And so you have Head Start represented, all of the school districts in Itasca represented, public health, the local community college, children's mental health. So they're all talking and building this program together. And then there are other committees that meet regularly, like they call it the Nuts and Bolts Committee, and that's the one where they really don't need all of the leadership addressing it, but they do need a committee that has the people that can really tackle the mundane details. So they meet regularly too. But the fact that all of these groups are working together around the state of Minnesota, they kind of look at us like we're just a total oddity, because they say, really? Your school districts and your Head Start programs are working together and they're like sharing resources? It's almost unknown to them. And for example, the Head Start director sometimes says, sometimes I think they're going to tar and feather me because I'm trying to promote something that others just aren't ready for. But working together, we have proven, and Amy's going to talk about the data that we have that does show that when these agencies and organizations do collaborate, things are just many, many more things are able to be attained.
And that's kind of the interagency collaboration piece around the early childhood programs. And then I kind of pick up from there, where I'm working closely with our Invest Early director. We meet it on a monthly basis. We have aligned our assessment tools. We originally had a response to intervention framework and a PBIS, or a positive behavior intervention framework, in place K-5, and so that framework's been pushed down into our early childhood programs. We coordinate, like I said, on a monthly basis, where the director and myself meet and we talk about the data piece and the curriculum piece. Our staff get together several times a year. Our preschool and our kindergarten and first grade staff get together. We review data together. But really, I think what changed for us was the leadership really needs to reach out to some of those early childhood programs, and so we've made just a very deliberate effort in Deer River to be working together and be talking similar language across pre-K through K programs, at least.
I'd like to add in just a little bit about the home visiting piece. Public Health has sat on the leadership team for Invest Early since its inception, as Mary mentioned. And what facilitated that was Public Health had a relationship with our local school district prior to the inception, and that really helped. We already trusted each other, and we're working together, providing home visiting services together. And so that really made that relationship more comfortable for the both of us. As far as home visiting, we recognize high-risk families at the prenatal level and from the child's birth. So we can make those referrals into Invest Early as quickly as possible, right from birth, for the most high-risk families. At that point, we tend to back out a little bit, however, and that's just due to staffing and funding. However, we do have a public health nurse that provides consultation monthly in each of the Invest Early classrooms. So the teachers do have access to our public health nurses for any issues or situations that might arise. And then Invest Early for any family that might need someone in the home. Again, Invest Early can certainly send them back to us. So thank you.
All right, thank you. We're going to go over to Delaware, the statewide model, and Harriet, you want to kick that off?
Sure. So I think people have in your packet a colorful slide. Okay, better? So you have this colorful slide where we have tried to show the 4 big buckets that we're using to try to drive the state's work forward. One is really around a healthy start for children. The second is around quality early learning, particularly for infants, toddlers, and preschoolers. The third is the connectivity and the continuity for early learning and K-12 schools, so that's the third frame. And the last is sort of systemic leadership and systems building. Within that, as I try to think about this question around where we are with alignment, basically around the institutions that work with our children and families on their behalf. There are a set of strategies we have that are within the Birth to 5 frame, and I think people have talked about that because we have multiple services and funding streams there. That work is in itself important, and then pieces that are tying together in the Birth to 8. So we have sort of horizontal and vertical things happening. So I'm going to outline at a high level, and then Daphne's going to talk specifically about one of our on-the-ground initiatives, the Delaware Readiness Teams. So I think first let me start with leadership. Everyone's touched upon that already, and that's pretty clearly important. So we did take an opportunity last year to create a new version of the state's strategic plan for early childhood. And we did that by leveraging actually these 4 priority goal areas that I gave to you that were really derived from the state's participation in the Early Learning Challenge. The advantage of what we did with our state strategic plan is we did it with our advisory committee, the Early Childhood Council, and it really then provides a unifying framework where we took all of these things and kind of pushed them to the next level so that we have everyone referring to the same reference point for how we decide what a priority is and where people would be able to focus their work. We've done other typical kinds of things I think that people around the country do. I've brought together amongst the state agency staff. Delaware has 3 state agencies and 7 divisions that work on early childhood. My office is connected to the governor's office, so I have a lot of players and partners out there that we need to be on the same path together for our children and families. So we pretty successfully brought that group together now on a regular basis to do planning, problem solving, leverage their resources and their policies and programs more effectively. We've done things like that around the state. So this last December, we actually brought together not only all of the leadership at the state level, but all of the partners basically from the various players in the community for an all-day strategic meeting that actually got very high review and high remarks and did help people to see that their work wasn't so isolated. And they, even for a small state, we said that people didn't all know each other, and we were right, they didn't all know each other, and so that was good for people. So we have various kinds of things around leadership. I'm not going to go into more detail, but those are some examples. Secondly, we started looking at things that are pretty critically related to children's development and learning to try to figure out where we could have the same strategy that would be present in any one of the children's learning environments. So one of the first things was child development screening, all right, where in fact what we saw was multiple organizations understanding the value add of doing developmental screening, but without any coherent approach to supporting the screening or identifying the screener. So we made an agreement across all the child serving agencies that everybody would use the same screener in the child serving agencies, so child welfare, public health through the home visiting programs, the early education programs, et cetera. And then we went about basically providing the training and the resources for people to be able to do that. And that has actually had an influence on also some of the district work because the districts in Delaware are really firmly in charge around Part B. And so they have been doing their own screening basically for the Part B program. And so that piece has been important, but it's principally functioned to try to create greater coherence across the Birth to 5 network, but in a broad sense, cross-sector, not just early childhood education, but also public health with home visiting, and again, with child welfare in the mix there. Moving into the next really important area from my viewpoint is assessment, formative child assessment. So Delaware did pass a state law that would require kindergarten teachers to conduct formative child assessment early in the school year. And so we initially worked very hard with the teachers and with the teachers union to gain acceptance for this initiative, which has gone very, very well and has actually been quite stimulating for the teachers and the classrooms involved. At the same time, we are taking the formative child assessment tool that is being used, and we are offering that same tool with training and resources into our Birth to 5 environment. And we're doing that through our Delaware STARS program, which is our unifying frame in the state for all of the early learning programs, regardless who's offering them. This is where the standards come from. Yesterday, actually, the governor did an announcement of enhancements we're making to that program, both improving its financial base, but also improving the rigor in its requirements, particularly on things that relate to intentional teaching. And the child formative assessment aspect of this is going to become an essential or mandatory part of the program now for the providers in the state. So this is pretty important because having our birth to 5 teachers and our K teachers have access to the same assessment tool is pretty critical in terms of a unification strategy. The next piece that we just started working on is we're very fortunate to have a pretty substantial award from the Michael and Susan Dell Foundation, about $1.5 million to now build out teacher dashboards. So we're building out teacher dashboards for the kindergarten teachers and for the Delaware Stars teachers around the formative assessment tool that they're going to have in common. We have a lot of data governance and data privacy issues to work out, basically, as we move this project forward, because obviously what we would like, we're going to house all of this in the state's longitudinal database for K-12, but clearly what we want is to figure out the governance and privacy issues in a way that we can have data sharing up and down the line, right, amongst the teachers, basically, for the children. So that will be, you know, another example of pushing this work forward. And then also related to this is issues that we don't have to think much about in a K-12 environment in K-1-2, but we do have to think about quite a bit in the birth to 5 environment is where's our core competence then of our teachers and leaders in the birth to 5 environment to be able to take on a greater focus on intentional teaching, developmentally appropriate intentional teaching. So as part of our reframe, basically, for Delaware Stars, in addition to things like saying doing formative child assessment is essential, we all have to do this, we are introducing basically requirements now for our programs to have a curriculum and assessment coordinator who has a credential that we'll be offering, so that we're really supporting leadership in the birth to 5 programs. And we are also going to be requiring those programs to make sure that their on-the-ground administrator actually also has a leadership credential in early childhood. So those are connected pieces because we have to figure out the support strategy for sustainability along with the other pieces on the ground. Last area I just want to mention before Daphne talks about some of our community organizing strategies through the readiness teams is related to standards. So like most states, we have very nice early childhood standards. They cover infants, toddlers, and preschoolers. They are across all the domains of children's learning. Like most states, we have K-12 standards, and they're very nice from a cognitive standpoint, but they have left out social, emotional, and approaches to learning. So we do have a partnership now going with the Department of Ed and a very good team of people working on building out approaches to learning and social emotional for K-1-2. So this is going to be an important framework change. Once we get that part of the work done, there's obviously a lot of work to make all of this come alive, you know, and make this real for our teachers and practitioners on the ground. Between that and the work on assessment, it will give us a better platform then to start to bring together the teachers who now have very segregated professional development. We did host last fall, at the request of the kindergarten teachers, they asked us to host a professional development Saturday conference for them, which we said we were happy to do because people neglect their professional development. We did. They planned the whole thing with our support, and we did have 40% of the kindergarten teachers in the state turn out on a Saturday, basically, for their professional development day, which is pretty impressive. And what we realized as I was sitting there during the day is we have really good opportunities to bring together the whole of this birth to 8 collaboration of teachers, but we still have to build the relationships and the trust that people will wish to do their professional development together, because I think we're not quite there yet. And I think we'll get there, but we're not quite there yet. And so one of the strategies to help us get from here to there is our readiness teams, which Daphne will talk about.
Okay.
Thank you, Harriet.
The Delaware readiness teams, we have 19 teams across the state based off of the readiness equation: ready families, ready children, ready early learning programs, ready schools, equal ready children. And those 19 teams are the grassroots approach to alignment. We have representatives, or attempt to have representatives, from each one of the pieces of the readiness equation on those teams, those local teams. And those local teams actually decide, how do we make children ready for school and life? They go through a community profile, which is really, in essence, a needs assessment. Once they go through the needs assessment and figure out what do we have, what don't we have, how can we build upon what we already have, and they make action steps. They decide what action steps they want to go from there, and then they're able to assess monies to be able to implement the action steps that they've decided to implement. So the teams themselves have come up with many ways to work together. They have, I think one of the biggest things that the teams has accomplished is the fact that people who haven't communicated with one another are now able to communicate with one another. So you have a parents as teachers, home visiting person in the same room as a elementary school principal, in the same room as in-home child care providers and also center providers, and also civic leaders within the area, and they're able to communicate with one another, come up with priorities for their own local area, and then plan for their own local areas. Literacy has come up as a topic for some of the teams, as well as health issues and many other issues have come up.
Okay, thanks so much for sharing those insights and experiences on the alignment piece. There's so many parts to that in that 0 to 8 continuum, and excellent information. I'm going to move to question number 2, and our second question has to do with what does success look like, and how do you or will you know if your initiative is effective? So that's success and effective questions. Amy, you look like you're ready to jump in, because I know some of the great data you've had from your program.
Just a little bit of background. King School is a very rural school. We have about 500 students, a little more than 500 students in my building. A little over 75% of our students qualify for free and reduced lunch, and so we have a very high poverty rate in my community. We've been fortunate where almost 100% of our students coming into kindergarten at King School have had the ability to go through our preschool programs. And so when we look at success, first of all, being able to reach 100% of our students almost. The students who really aren't going through our programs probably just moved into our district, are those the students that wouldn't have gone through our preschool programs. But so success is very much, we're able to reach as many kids as we can prior to kindergarten. Obviously, we'd like to reach them even earlier. At least most of them are going through our preschool programs at age 4, and we're reaching more birth to 4 as well. But some of the success we're very data-driven. It's not just about collecting data and doing assessments, but it's about creating a framework for having teachers talking about data. And we're super intentional about assessing all of our children birth to age 8. We use a very similar model like I described earlier. We facilitate those discussions. We do benchmarking 3 times a year. After each of our benchmarks, we meet together as grade level teams or school teams, and we review which students are not on target. Based on which students are not on target, we do more diagnostic work. We identify where interventions need to fall, whether we need to be looking at letter naming, letter sounds. Our focus in the last couple years has been around oral language. We often know that students of poverty do not come in with the same vocabulary banks as the other students. 30 million word gap study is very relevant here. And so many of our interventions focus on that oral language piece. And I just have a graph in front of me that when we've started being very purposeful and intentional, our data, for example, in the fall, we may have 85% of our students not on target. At the end of the year, almost 80% of our students are on target going into kindergarten. So that's in a population with about 75% free and reduced lunch, that the majority of students are on target entering kindergarten, which is pretty phenomenal. When we didn't have that model in place in other districts in Itasca County, the district with the lowest free and reduced lunch actually has half of the number of students on target as us. And so we're very intentional about our data, how we analyze our data, but also about progress monitoring. Every student that's in an intervention is monitored for progress, and if they're not making progress, we change the intervention up. And so for us, success has really been about kindergarten readiness. We also have long-term studies and longitudinal studies that are occurring, and so students who have been through our Invest Early program are now in 3rd and 5th grade, I hear. We've gone up into over 3rd grade, and so our state assessments data is now coming forward with those students who have been through our Invest Early program, and those students are on target with their peers who were not of poverty, and so we're able to really demonstrate that those are long-term effects as well. What else? I think that's probably the biggest thing, the kindergarten readiness piece, the long-term piece. We're really seeing that the data is demonstrating that students are coming in with better oral language skills, early literacy skills, and we focus on early numeracy too, and so those students are just coming in ready to learn.
From a home visiting standpoint, we're very family-oriented. We're very strengths-based, so a lot of our successes come at the family level. Number one, we want that family connected with resources and also be utilizing them appropriately. We want infants and caregivers to have a really secure attachment from early on, because that does set the stage for that child's relationships the rest of their life. That includes with teachers and with peers moving forward. We want healthy pregnancies. We want healthy birth outcomes. That really sets the neurologic stage for that child and sets their health and wellness from the start. We want families to increase their self-sufficiency, and we try to help them just by connecting with the resources, whether it be financial or otherwise. We want families utilizing preventative services. We would rather see them getting their immunizations and having their well child checkups versus ER use. We want decreased injuries of children. We want decreased maltreatment reports, and those are all outcomes and successes that we follow.
And Amy mentioned the longitudinal study. We've been working with Wilder Research in St. Paul ever since day one of the program. And they've been tracking all kinds of outcomes, not only with the children, but with the families and with the systems. And I know our lead evaluator has said to us before, I can't believe you actually take all of the data that we've analyzed and then you do something with it. He seemed surprised that somebody isn't just putting it up on the shelf and then saying, moving on. So the fact that every year we gather with our evaluator face-to-face, go through the entire document, all of the results, and then make sure we understand them, and then once he has left, then there are multiple other meetings to see, okay, now, how do we address the weaknesses that the evaluation pointed out, and looking at our strengths, what can we do to even build more upon these strengths? So like Amy mentioned, you get the data, but if you're not going to do anything with it, what good is it? But the teachers get so excited and so motivated when they see how their kids are improving that it's definitely the right thing to be doing for
That reminds
teachers.
me, we do the same data collection, obviously, as students are coming into kindergarten, but we're able to take a look at some of that data we have a data warehouse that we have similar to what you were describing, where our kindergarten teachers can see that preschool data, and they can see that diagnostic work and where that child was at in preschool, so that data system is aligned really age 0 to 12 in our district, or to 12th grade in our district. So teachers are able to kind of go back and see that. And we use our kindergarten teachers and our first grade teachers use that data from preschool, and it's just a seamless system.
I think that we would know when we have success, obviously, when we have children that are happy, healthy, safe, and ready for lifelong success. But there's many different components and many different initiatives that have to be in place in order to get there. Obviously, we have to have a skilled workforce that gets paid well, and we need higher education institutions that prepare them and inform them of best practices, developmentally appropriate practices. And so I see that data, we've heard that over and over again, is critically important. Early childhood professionals typically are not familiar with that mindset, but I can tell you that once they do become familiar and comfortable with it, they do get really excited and they do get jazzed up about, they feel empowered as teachers for the first time. And so I think that's very exciting, and it does push us in the right direction. As long as we maintain developmentally appropriate practices and make sure we're doing the right thing for the right reasons.
Thank you,
Okay,
Jean.
this is a hard question. What is success? Because I think, as you know, as just mentioned, it's kind of complicated. So clearly, the bottom line is improvement in children's outcomes in all those really important domains of their learning. But a couple of highlights of things that I guess are where we're trying to head and look right now is to make sure for their early childhood education programs that we have been successful in implementing STARS as our framework across all of the sectors who are offering services to our youngest learners. So that's our schools, childcare, and Head Start. And that we have high participation at the highest level of the STARS program, with particularly high penetration for our low-income children. To help us there, we have hired an external evaluator. We've actually hired RAND to assist us. And actually, we've had very good support from both the U.S. Department of Education and from HHS in terms of bringing additional people in to help us with interviewing and conversations with our provider and stakeholder communities to get qualitative feedback on how things are going, so it's not tainted by people who are working with people every day, talking to them. We have done things like taken a deeper look at our cost modeling and financial structures. And as I mentioned, we actually announced yesterday publicly a whole set of changes and enhancements to our model to be able to make it work better. So there is an aspect around getting to success that does mean being willing to make changes as we go and to gather information as we go to try to get to a better endpoint. A second thing I would say is a success for us is to have a really good ongoing capacity to track child outcomes in all of these settings, and as everyone else here has talked about, to use that information both at a practice level and at a policy level to be able to make systemic improvements. So I would say Delaware is early in that journey, but it's a pretty important journey for us to be on. A third area for success for me actually has to do with money. So sufficient public will and public funding so that work that we're doing now that's creative and innovative can actually be sustained, and that the resources really are in place basically and responsive to be able to get the work done. I think Delaware is no different from most other states. We have issues obviously in K-12 funding, but from a parity standpoint, our issues are even more severe within the early childhood education aspect of the work for infants, toddlers, and for preschoolers. Fourth area I would mention is roughly what I'd call workforce parity, that we just took a look at all of our statewide data, looking at our birth to 5 teachers and our K-12 teachers, and what I can tell you is that even for our early childhood education teachers, those who do start with a BA, that their average compensation is equivalent to the aides in our K-12 teachers. So that's not a good place for us to be. So clearly we have a lot to do here still on workforce parity. And professionalization within our birth to 5 frame. And we have active interest in the state because there is a recognition that we have problems within the K-12 frame as well in terms of pathways we've created. In our early learner survey, our kindergarten assessment, one of the things that we've done is we have really leveraged off these good relationships with the teachers, and we've kind of created teacher leader positions amongst the kindergarten teachers to work on our assessment work, so that we're trying to find ways to take good kindergarten teachers and to give them something, some additional status, some additional resources, keep them in the classroom. So a lot of issues around that need to be done, as well as what I mentioned, to me, part of success, can we have a better integrated and shared approach to how we support teacher effectiveness, teacher improvement strategies that really give us a birth to 8 focus. The last 2 pieces, I guess, that I would mention here are, in general, success is a understanding and a view that we have done a good job on child continuity and transition practices, basically for any child in the system, all right? And it's sort of regardless of where. We are big supporters for our families to have diverse choices for their kids. It's what they want. And so we know we're going to be continuing to develop a lot of different opportunities for families to make choices. And that's going to be true both in the birth to 5 context. It's also going to be true within the K-12 context. And so within that, these issues around continuity, information sharing, transition at every level are pretty critical in terms of the work. The last thing I just want to mention here is I did say that we have some external evaluators helping us. We're in an unusual position to do that. Most people here I know who work at the state level, you don't get to spend public dollars on evaluation people, but because we have challenge money, we can. So in addition to having RAND to help us with Delaware Stars, we do have Child Trends helping us with our early learner survey, our kindergarten survey, doing an implementation study to assist us in being able to get that work done. And then we are well on our way to actually getting our regional lab for US Ed to be our evaluator for the initiative that Daphne is leading, because that is something that we want to be able to look at over time and think it's complex, actually, for people to see what the value add is in creating these kinds of teams, and that it might take money. So that's another area where we're looking for external evaluation to assist us in the initiative.
Thank you. Daphne, anything about successes you'd care to talk about? Or?
Well, successes within the Delaware readiness teams, basically it's been the communication that has happened between members of the teams. For example, I was actually at a meeting the other night where there was a parent who was of a Hispanic background, and we had people there to translate and be able to hear feedback. And around that same table, we had a civic leader, a councilwoman, we had someone from Head Start, we had someone from other areas. So a lot of times intrinsically, through these grassroots efforts, sometimes you don't even see on paper and in the minutes all of the successes that take place. But what is taking place is relationship building. And one of the things that we always stress throughout all the teams is that through this relationship building, that major successes are taking place. When two entities that haven't talked before can then connect and then figure out what it is that they can do together and how they can work together, that's where most of the success is taking place. Along with that, I think that we also are helping to link all the pieces in the plan for Delaware together. One of the things that myself and the rest of the facilitators for the Delaware readiness teams recognized at the partnership meeting was the fact that we are the link in between all of the pieces that come together. So we're able to have that communication taking place and ongoing beyond a partnership meeting and things like that.
Yeah, thank you so much. Thank you for touching on those soft skills that are so important in the relationship building across the continuum and the leadership that it takes to move it forward. We've got about 15 minutes left, and we've got a third question we'd like to ask this morning, and that is, what obstacles, probably had a few, or challenges have you faced in trying to implement a more continuous system from birth through age 8, especially when children are transitioning between those programs or those settings? That's a big challenge. Anybody want to jump in? Okay, Kelly, thank you.
Sure. Staffing and funding to provide the intense home visiting is our #1 challenge. We just haven't necessarily had the capacity to provide the intense services that are really necessary to have outcomes for the most vulnerable families we work with. Engaging early on, especially prenatally, that's always our goal, and sometimes connecting with the families early on can be a challenge for a multitude of reasons. There's a stigma attached at times when the county comes into your home, and not necessarily that public health is the creator of that stigma, but if a family has ever been involved, perhaps in the social service system or the corrections system, it can be intimidating to have a county professional in your home, even if we don't necessarily, we're not in there for child maltreatment investigation. And then being able to stay in the home, even when other programs get involved, such as Invest Early, we really have to look at our resources and utilize them where we can provide the most impact. And so it would be ideal if we could stay in maybe a little longer and further facilitate that transition, but it's just not possible at this time. We're hoping that will improve. We're looking at other funding sources to improve that intensity and longevity with the families.
Kelly, could I just follow up a little bit too? Could you
Yes.
tell us a little bit, we haven't talked too much about the diversity in your area, and what is kind of the cultural makeup?
You want me to speak to it?
Sure.
About, in Itasca County, at least in Deer River, we have about 40% of our students are of Native American background. And like I mentioned earlier, about 75% or more are in a high poverty situation. That's pretty much the diversity in Itasca County. We're very northern Minnesota. Yep, located next to Leech Lake Indian Reservation. So,
Thank you.
a couple other challenges I just kind of wanted to speak to is I didn't mention earlier, but our preschool programs are actually, we have students that are 4 days a week, full days, and so we have, those kiddos ride the bus with our K-12 students. They come to school at 8 in the morning, they leave at 3 in the afternoon, and so that was just an important piece. I see some people kind of going, oh, okay. That's pretty unique. We're able to really meet the needs of those preschoolers full days for 4 days a week. So some of the challenges would be, can we be able to meet, those needs at an earlier level? We have about 6 classrooms in Deer River for students who are kindergarten eligible, those 4-year-olds. We have less options available for 3-year-olds and then infants and toddlers. So, the challenge would be obviously to be able to meet the needs of all of those students in that continuum. The other piece of it that I think too are some of the challenges that we face is when you're dealing with different agencies, whether it's federal or state or across different types of agencies, every agency really has their own requirements or how you can spend dollars. A good example is when we're working through a response to intervention model and there's certain requirements under special education or early childhood special education dollars. It just gets to be a challenge to be able to meet the needs of all of those different agencies, and I think, Mary, you might be able to speak a little more to that as well. The communication between preschool programs and the elementary building is a challenge. You have different schedules, you have different teacher contracts, and so to be able to pull those teams together, we have teams that are dedicated to kids, and so, we just stay focused on what's good for kids, and so we're able to do that as much as we can, but there's time to be able to do that. What else did I want to say about that? Did you want to say anything about the dollars?
Well, I was just going to add that you've heard all of us talk about the relationship building and the trust building and the working together. And yet then the state agencies and the federal agencies, it seems like they're doing whatever they can to put barriers in the way of that happening. So we would really like to see incentives for people to work together. And just to give you one small example, because we have what we call blended classrooms in Invest Early with Head Start teacher teaching alongside a school district teacher, when they have to have a sub, that sub has to have a background check by Head Start and by the school district. Now, wouldn't you think they could just do one background check? And when you're talking $20 a pop, that might not seem a lot, but to a tiny little rural area, that's big bucks. So here they're paying double for one check that if only the bigger agencies could somehow work together and figure out how to take some of those obstacles out of the way, it might encourage more groups around the country to work together better.
And Amy, can I just follow up with a question? One of the challenges for school principals, having been one for 27 years, is getting the information from previous interventions, from early childhood programs. You spoke a little bit to that. Mm-hmm. Can you just say a few words about how are you dealing with that information and tracking the kids?
That really hasn't been a challenge for us because we work so closely together, and it's because I work so closely with the Invest Early program, we actually share the same database. So students who go through our Invest Early program, those students are part of our school district database, and that information is shared between us. We also have Leech Lake Head Start, which is within our district, but they have been very willing and understand the need to collaborate, and so we're able to share data. They join our meetings as well when we have our transition meetings talking about transitioning to kindergarten, or our data sharing meetings. So they've been able to share. I would say the challenge would be making sure our assessments are aligned. They reach out to us for guidance and help in some professional development. So we've been able to kind of be on the same page with that.
Great. Thank you. Harriet, do you want to talk about challenges and obstacles?
So I just wanted to mention 3 challenges or obstacles. They actually completely align with what you all said. So first, relationships. I mean, yes, we have to have these important structures, but a lot of this work is mediated by relationships and by having smart strategies that people who have the same best interests of the children together are in relationship. And so that's teacher to teacher, it's instructional leader to instructional leader, and so forth. So I'm not going to talk about solutions. We've actually been trying to work on each of these things. This is just the challenges. But I do think this issue of sound, positive, mutually respectful relationships is an issue if we're going to be talking about a birth to 8 frame. Okay, because it's a different way of trying to think about the world. The second, which was already mentioned, I actually think, Fred, you said this in your question, is information flow about children that facilitates teacher knowledge and support, and also teacher relationship building with families. Okay? You know, that's pretty critical here. Nobody likes giving the same information about their kids over and over and over again. It's not appreciated. So I just think that piece is pretty critical. We haven't talked a lot about families here. Families are a really important partner in all of this. And so making sure that as we are connecting the dots, we're doing this in a way that engages and really understands the essential nature of the family partnership. And then the third one that I don't think people have mentioned quite as much, that I just want to put out there as an obstacle, is, of course, this issue of general public education understanding about what we're trying to do. Because part of this is trying to help people to appreciate and to get to a place where the sorts of things we're chatting about here seem like normal. They seem like run-of-the-mill, what should be happening, what would be expected. And so I think securing greater public and community understanding and commitment is an actual challenge and obstacle and requires ongoing, very proactive work. So those are, you know, there are more we could talk about, but those are at least 3 I'd call out.
Thank you. Jean?
Everyone has pretty much mentioned the things that I had on my list, but there are a few that I want to highlight. We see that there's often a different philosophical base or belief in terms of effective instructional practices. And I think that it's important, particularly for children who live in poverty, and I think I touched on this before, that brain development is often very different for those children for a number of different reasons. And I think that we have to be mindful of that because, for example, executive functioning, those are the skills that so often those children miss out on. And we see that that alignment does not occur yet in other systems of care. For example, I was talking to someone who is a correction officer about executive function, about difficulty taking the perspective of others, or impulse control, and all those things. And his first response was, this is the very thing that all of my clients are missing out on. And so I think that we have to see how this applies not only to early childhood, but also across to other systems as well. I also think that higher education very typically has yet to embrace this whole concept of early brain development and understand how to roll that out with the students that are enrolled in their coursework. And I also think that it's a huge paradigm shift to move from activity-driven or rote learning, or teaching rather, to standard-driven cycles of intentional teaching practices, and that it's a huge shift for teachers to move in that direction. And teachers who feel really, really confident and really good about their skills pretty much overnight all of a sudden feel very insecure. And so those supports need to be in place to help move that forward. And I think everybody else talked about different requirements. Parents, you talked about parent engagement. And I think that, you know, we spend so much time trying to help parents understand that the critical importance of early childhood and the beginning years of life. But also, more importantly, how can they help promote the development and learning in their children? How can we help them to understand the standards? Because the standards are really not that challenging to understand if we can communicate where we feel confident and comfortable about what they represent.
Thank you, Jane. We have about 3 minutes left, and I just wanted to follow up on, you mentioned, you know, working with higher ed and their role, and I would want to ask the Minnesota people specifically. You have 2 community colleges involved in your project. How do they work with the 0 to 8 through Continuum? What's their role?
Actually, there's just one community
one,
college,
okay.
right, Itasca Community College. And very early on, in fact, before the model even began, we met with the college people to make sure that they had, you know, the CDA, the Child Development Associate Certificate in place, and then the 2-year program in place. And then they made sure they had an articulation agreement with the 4-year college so that, again, that whole career ladder could be established. And because it was done right from the beginning, there's been an ongoing supply of quality teachers, which has been great to, you know, because I know a lot of people are concerned about that. You know, what are we going to do if we can't find the quality teachers to run these programs? But we haven't had any problem with that, and I think it was because, again, we started from the very beginning to put that in place before even introducing the model.
The committee is very interested in that workforce development piece, so thank you very much. And we've got 2 minutes left. Is there anybody that wants to comment on the
Can I
workforce?
just say one more thing about
Sure.
the teacher prep? I would say one area that we do not have the support, though,
Uh-huh.
is special education teachers. That
Is it?
is
I'm
the
sorry.
special education teachers
Oh,
that we
yeah.
need more of that development around early childhood special education teachers and those emotional behavioral disability teachers. There's a need there that, yeah, that's
Thank
a
you.
challenge. Yeah.
Any last comment on the workforce development with your projects? Just a brief comment.
If I
Harriet?
oh.
Well, I was just going to say another piece that we're working on now, because I've had a concern that our higher eds, and even in a small state, there are still enough of them that you have to think about, are they working on transfer and articulation or not? That we've actually gone and surveyed because we wanted to try to figure out whether, as they were looking across, they were actually focusing for people in higher ed on teaching what we needed for our teachers. In other words, how we're focusing on curriculum, how we're focusing on assessment and screening. So we have succeeded in engaging all of the higher eds and helping us to answer the questions. They started, of course, by telling us everything was hunky-dory. And I think that it might look a little different when we're done finishing analyzing all the survey responses, and we'll give some pieces. But we've also seen some wonderful things. So Delaware does have early childhood high school majors. And as a result, we were able to get going pretty quickly with some of the schools doing this to actually create early college dual enrollment for our high school students with higher ed. So that we can have people basically who we, of course, want everyone to pursue appropriate post-secondary work, and we'd like that to be college-oriented. So that's exciting because we're also helping kids earlier on in high school, basically with any remediation issues that would be challenges for them in college entry. It's allowed us to start to build out more of a practice continuum for the high school students in terms of visitation into their early childhood classrooms and a better experience for that. And I think it will, it will lead to people actually having some early college credits. So we've had a lot of cooperation and interest in that kind of initiative. But I do think this higher ed partnership piece, it's just really critical here. In terms of making the whole thing work out, especially as we think about more of a shared frame around who the people are and what we're asking them to do, infant, toddler, preschool, K1, first, second, third grade.
Thank you very much. The red light is blinking. We're out of time for that portion of the panel, and Thank you so much for your authentic, great experiential answers to those three questions. We're going to shift gears a little bit here, and we're going to move over to my colleagues on the committee. You have 15 minutes now to ask this wonderful group of people questions, and I'd like to ask you to do this. If you would just identify yourself. Do we have a roving mic here? Good. Bridget's got a mic that's going to be coming around. If you just identify yourself and your affiliation, that would be great. And let's go to Ross Thompson.